On this Wednesday night, the world prepares as the COVID-19 virus spreads.
I think there's pretty good agreement that we are heading towards a pandemic.
How ready is Canada? How ill-prepared is the U.S.? And the confusion for travelers. Plus, what do the warnings this could disrupt our lives really mean? I'll speak with an infectious disease specialist. Tempers flare in Tyendinaga. Fired up protesters find new ways to try to disrupt rail service. Why they weren't arrested. What climate change will mean for Alberta. A new report on how the province needs to adapt.
Global National with Dawna Friesen.
Good evening and thanks for joining us. We begin with what could be a tipping point in the spread of COVID-19. The World Health Organization now says there are more new cases of the coronavirus outside China than inside that country. There are cases in every continent except Antarctica now. With attention shifting from Asia to Europe, countries there are struggling to come up with a unified response. And with so many unknowns, there's confusion about whether to travel and what to avoid. Here's what we know about where the virus is spreading outside Asia. Right now, the biggest outbreaks are in Italy and Iran, and from there, the infection is spreading kind of like a web across the world. People who had been in Italy are now linked to cases in Algeria, Austria, Croatia, Germany, Greece, Spain, Switzerland, and Brazil. And people who had been in Iran are being linked to new cases in Bahrain, Iraq, Kuwait, and Oman. Canada has recorded a second case in someone who traveled from Iran, and it's the 12th confirmed case here. At least 46 countries and territories have detected the virus, and dozens of passengers who were let off the Diamond Princess cruise ship in Japan have now developed symptoms, and a fourth person has died. Now, another cruise ship has run into trouble as well. 6,100 people are on board the Meraviglia. It's been turned away from Jamaica and the Cayman Islands because a crew member has flu-like symptoms and is now in isolation on board. The cruise ship company says it's just a case of the flu. The ship is en route to its next port of call in Cozumel, Mexico. And in Italy, more than 400 people have tested positive for the virus. That's the biggest outbreak outside Asia. Crystal Goomansingh has our top story tonight.
Chemists in Milan are mixing up batches of hand sanitizer. Customers concerned about the new coronavirus bought up all of the available stock. Italy is the center of a European outbreak. Red zones in the north are being patrolled by members of the military and police. Anyone trying to sneak in or out could be jailed for 3 months. This Saskatchewan woman is stuck in Milan waiting.
Our classes were suspended for the following week, so this week. And that's basically all we've heard so far.
Iran is another location of particular concern. It's believed there are far more COVID-19 cases there than Iranian officials are reporting. A special investigative team from the World Health Organization will arrive there this weekend. Similar teams were deployed to China, and one is working in Italy.
We take the virus and the situation very seriously. At the same time, we should also remember that 4 out of 5 patients have mild symptoms and recover.
The fact that COVID-19 can be mild in some could be obscuring the true number of infected individuals. Dr. Michael Gardam says it's likely there are many more people out there with the virus.
We have not stopped anything. And I think that, the academics, the people like me who are out there looking at the epidemiology, I think there's pretty good agreement that we are heading towards a pandemic.
Slowing the spread is critical, but responses are different in each country. In London, for example, the energy company Chevron told people to work from home until test results come back for a worker with flu-like symptoms. The UK has 13 cases. South Korea has more than 1,000 cases, but buses are still rolling after being disinfected. In uneasy times, this driver says it gives him a bit of comfort. Crystal Goomansingh, Global News, London.
Preparing for a virus that's new to humans and that experts still don't fully understand isn't simple. Canada does have a plan on how to handle pandemics. Tonight, Couteur takes a look at the mechanisms that are in place to tackle an outbreak. Mike?
Well, Dawna, as COVID-19 has evolved into a wider global outbreak, so too has the federal government's approach to it. While the health minister says the current risk in Canada is low, Patty Hajdu is acknowledging that could change.
Globally, there's a higher likelihood that we'll see an outbreak in Canada.
Hajdu doesn't want Canadians to panic, but she says it could be prudent for people to be prepared just in case.
It's really about, first of all, making sure that you do have enough supplies. If someone in your family becomes ill, if you yourself become ill, that you have what you need to survive, for a week or so without going out.
Hajdu says Canada's National Microbiology Lab in Winnipeg has a more robust test for the coronavirus than the U.S. So in some ways, we're better prepared for a possible outbreak. And she added there's a federally coordinated pandemic plan that's been in place since 2009.
There are a lot of similarities to how we would manage this compared to H1N1.
Dr. Susie Hoda says some of the lessons learned from that outbreak and SARS were to ensure proper screening and proper protection for healthcare workers. Then there's the plan for people in the community, from things as simple as frequent hand washing to a more extreme step of suggesting people avoid mass gatherings.
Sometimes schools and other areas where people are congregating quite a bit can get closed. So we modify the way that we interact with each other so we reduce that risk of people exposing each other.
Canada isn't there yet, and to further calm fears, Ontario's chief medical officer says we have a distinct advantage compared to past outbreaks.
We know the organism, we have a lab test, and fortunately for us, we have the experience of what China has worked through. And we have our epidemiologists and our experts informing us what they learned, what they know, what we do with this virus.
Doctors say sharing information internationally can help mitigate a global pandemic, adding 10 years ago, that level of coordination and collaboration didn't exist. Dawna?
Okay, Michael Couture in Ottawa, thanks. In the U.S., President Trump just addressed the American response to the virus. He's blamed the media for making it look as bad as possible. Today, he said he doesn't think the spread of the virus is inevitable, even though that's what officials from the American Centers for Disease Control said yesterday. There are 60 confirmed cases in the U.S. now. That number is likely higher, though, because few people have been tested, and many test kits were found to be faulty. Jackson Proskow has been listening to the president. Jackson, what's his message?
Well, Dawna, the president spent most of his press conference repeatedly downplaying the threat of coronavirus, suggesting it's very much the same as the flu, even though its mortality rate is much, much higher. Trump, in fact, expressed his own shock at learning about the mortality rate of the regular flu. He bragged that the U.S. is better prepared than any country. He said all cases of coronavirus in the U.S. will still be gone. That does not jive with what his own experts have been saying in recent days. They've proclaimed that it's practically inevitable that coronavirus will arrive in larger scale and community transmission here in the U.S. In the near future. He also said that a vaccine will be here soon. His own experts have said it's a year to 18 months away. Bottom line, Dawna, he's taking issue with the idea that spread here is inevitable. Take a listen to what he said a short time ago.
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world.
Jackson, the president, sounding very optimistic. Not many people in the U.S., though, have been tested. I think it's about 500. That compares to tens of thousands of people in countries like South Korea. And the CDC has admitted that some of its test kits are faulty. What's going on?
Yeah, there's a real concern here that no one has a full picture of the spread of the virus here in the U.S. or whether community transmission is already taking place because of those limits in testing capacity. As you mentioned, faulty kits, they've been very narrowly distributed to only 4 or 5 sites. The situation's so dire for some health authorities that in Hawaii, they've asked to send their samples to Japan for verification. Dawna, the president has appointed his vice president, Mike Pence, to oversee all these efforts, but suggested that there's no need to ramp up testing capacity right now.
All right. Jackson Proskow in Washington, thank you. There's a development tonight in the rail blockades in this country. The Wet'suwet'en and Hereditary Chiefs say some progress is being made about the RCMP presence on their territory in northern BC. Protests, though, and blockades keep happening elsewhere. Today, one reached a potentially dangerous new level. A fire was lit along the tracks in Tyendinaga Mohawk territory. That's not far from the scene of a major police operation earlier this week. The flaming debris eventually forced that train to stop temporarily. The federal transport minister calls what happened extremely reckless. David Aiken reports.
A CN rail engineer sounds his horn time and time again. But protesters remain on the track.
The train's not stopping, the train's not stopping.
And then, at the last moment, these self-described Mohawk warriors scurry for safety. Some pick up rocks to hurl at the passing train. This dramatic video was filmed by one of the protesters and streamed live on the group's Facebook site. Now, though Ontario Provincial Police dismantled a separate barricade at Tyendinaga on Monday, these protesters are at a new site, 2 kilometers away. And when CN Rail put its first trains through here in nearly 3 weeks, some protesters threw burning debris on the tracks to try to stop it.
This was an extremely reckless act and something that not only put in danger the life of the people who were actually lighting this fire under a moving train, but also could have been very dangerous for many other people.
Then, later in the day, at another rail crossing 9 kilometers west, a car is driven onto the tracks and set on fire. But the Tyendinaga protesters say they will not stand down until the RCMP leave Wet'suwet'en territory in northern BC. And further east in the Quebec Mohawk community of Ganawage, more blockades, also in support of the Wet'suwet'en.
The Canadian government has to come to an agreement with the Wet'suwet'en chiefs. That's what it's all about, and that's where the pressure should be.
Meanwhile, Quebec Premier François Legault suggested Wednesday that the Ganawage protesters were armed with AK-47 assault rifles. Legault offered no proof, though, and Mohawk leaders accused Legault of inflaming tensions.
There's no armaments, there's no arms or anything like that, you know.
But it's clear that tension continues to build at many of these flashpoints across the country, and that tension may not begin to recede until the Wet'suwet'en hereditary chiefs resolve their differences with the RCMP. Dawna?
Okay, David Aiken in Ottawa, thanks. There was some optimism earlier today from those hereditary chiefs about the presence of the RCMP, and there were more talks today, but late today, it seemed to fall apart. The chiefs said only partial concessions have been made by the federal and provincial governments. They want the RCMP and Coastal GasLink off their territory. The chiefs claim both governments have now pulled out of talks with cabinet ministers that it was thought might happen tomorrow. Global's Sarah McDonald is in northern BC and explains how the day played out.
Signs of optimism and dialogue Wednesday in northern BC as Wet'suwet'en Nation's hereditary chiefs return to the table for another day of talks.
Their willingness federally to come here is there. And our hope is that today will be the day we can move forward.
That this week have involved former longtime member of Parliament Nathan Cullen, acting as an intermediary between all sides involved in a standoff over pipeline politics. Arrests on Indigenous lands only adding fuel to the fire of a national crisis that's quickly veering off the rails.
The injunction says that we're trespassing on CN property. As far as we're concerned, CN is trespassing in our territory.
This chief of Gitxsan Nation, a longtime neighbor and ally of the Wet'suwet'en. One of those detained on Monday as RCMP moved in to clear a blockade erected in solidarity with his hereditary counterparts.
The Gitxsan Nation couldn't very well stand by and let them take all the heavy lifting.
But a large faction of Wet'suwet'en people, like Bonnie George, are banking on the benefits promised by that lucrative proposed natural gas pipeline and on constructive dialogue.
The ones that are protesting across Canada and downtown Vancouver, they have jobs to go back to, and our people don't have jobs.
Many here welcome the economic opportunity offered by the multi-billion-dollar project, given the green light by band councils and backed by the provincial and federal governments.
We feel like we're being bullied by people who are supposed to be our leaders.
But not the traditional leaders, who maintain their conditions must be met first before any talks with Ottawa, as all eyes remain on Wet'suwet'en Nation.
And that's a Global Sarah McDonald reporting from northern BC. Late today, word no further talks are planned, so it looks like it is back to square one. Coming up, what climate change could mean for Alberta. A new report on the impact on that province's economy, infrastructure, and health. A new report on the impact of climate change on Alberta has just been released with no fanfare. It's written by a world-renowned climate scientist, but commissioned by the previous NDP government. It warns climate change will have a profound impact on infrastructure, economy, and public health in Alberta. Heather Urix-West explains.
In the past decade, Alberta has experienced the devastating power of extreme weather time and again. From the 2013 flooding in High River and Calgary to the 2016 fires that burned much of Fort McMurray to the ground. Climate scientists warn that as global temperatures increase, these kinds of events will only become more intense.
In a warming world, wildfires, which always happen naturally, are burning greater area. Floods, which always happen naturally, are much more intense with a lot more rainfall associated with them.
Catherine Hayhoe is the climate scientist behind a new report into Alberta's climate future. Among the report's findings, a rapid increase in the number of days above 30 degrees Celsius, winter warming trends twice the global average, drier soil conditions, particularly in the southern part of the province, and more rain during the winter months. It also warns Alberta's projected climate changes will profoundly impact its natural environment, potentially affecting the province's agriculture, infrastructure, and natural resources, as well as the health and welfare of its inhabitants. The report was commissioned by Alberta's previous Environment Minister.
I think what we need in Alberta and across the country really is a better assessment of what is to come so that we can properly make investments for climate adaptation.
The final report was delivered to the United Conservative Party government in August, but was not released until earlier this week, despite two separate Freedom of Information requests made by Global News and the Alberta Federation of Labour. Someone also backdated the report to make it appear as though it was posted in September, burying it behind months of more recently released reports on the provincial website.
It's clear to us that the Kenney government has made a concerted effort to bury this report, and I say that because of all the hoops that we had to jump through in order to get our hands on it.
But the UCP denies any effort was made to bury the report, pointing out it's now available for the public to see online. Heather Urix-West, Global News, Calgary.
Ahead, just call me Harry, why the sixth in line to the throne is back in the UK. Peter Nygaard, the Winnipeg-born man who built an international fashion company, has stepped down as CEO after sexual assault allegations emerged. The announcement was made hours after the FBI and New York City police raided his Manhattan headquarters. Nygaard is under criminal investigation for sex trafficking. At least 10 women filed a civil suit against him, accusing him of sexual abuse at his estate in the Bahamas. Prince Harry is back in the UK, and he made a special request on his final round of engagements before he steps down as a senior royal.
And he's made it clear that we are all just to call him Harry. So
just Harry. He was in Edinburgh launching an eco-friendly travel firm. The Duke of Sussex asked the host to ask delegates to drop his royal title. Prince Harry, or Harry as he wants to be called, will wave goodbye to his royal duties officially in less than 5 weeks. Preparing for a pandemic next, why one expert says it's too late to contain the spread of COVID-19. Welcome back. We're going to go back to the new coronavirus now, what to make of its spread and how it could disrupt your life. Joining me from Toronto General Hospital is Dr. Isaac Bogoch. He's an epidemiologist and a specialist in infectious disease. Dr. Bogoch, first let's deal with travel. Lots of people have trips booked to Asia and Europe and Iran. It's hard to know whether to go or to cancel. What would you tell your family?
I think it's extremely important for people to remain up to date on what the current travel advisories are and what the current travel warnings are. Certainly we know Canada has very publicly made this very widely available on their websites, certainly with the travel advisories, but I think it's important that people look at their destination countries as well and any points of contact along the way toward their destination. The other challenging feature here is that these might change with time, so it's important that people stay up to date on what these travel advisories are.
So, washing your hands, coughing into your elbow is great advice, of course, but the way this seems to be spreading, is there really a fail-safe way to protect yourself?
No, I mean, there's just things that we can do to reduce our chances of getting this infection. And I know during influenza season we have these recommendations, and these recommendations still stand for the COVID-19 infection. We also just have to remember that COVID-19 is a respiratory infection as well. So, you know, impeccable hand hygiene is crucial. Coughing and sneezing into your arm rather than into the air around you or into your hands is also important. And of course, if people are sick, stay home so you don't infect anyone else at work or at school.
Yeah, staying home, probably the best advice. We know that most people who get this virus do survive, and it's important to keep saying that. But we've been told to prepare for this to disrupt our lives. What do you think that means in practical terms for most people?
Well, it's not yet clear what the impact of this will be in Canada. Certainly, we know that there's going to be more cases, either imported cases from other parts of the world, and even the potential for locally acquired cases as well. Of course, as you point out, most people that get this infection are probably going to do just fine and have a mild course of infection. But yeah, some people are going to get pretty sick. So I think it's just important to be aware that over the next few weeks to months, we're likely to see more and more cases of this, and to be prepared. I mean, if people have chronic medical conditions, now is the time to go to your primary care provider or specialist and ensure that you're up to date on all your prescriptions, up to date on your vaccinations, up to date on ensuring that your health is optimized before we start to see more of these cases here in Canada.
Quick final question. Based on what you know so far, do you think this virus can be contained?
No, I don't think it can be contained. Certainly the massive public health initiatives in China slowed the spread of this virus down, and it really bought the world a few weeks to maybe a few months to prepare for this. Hopefully governments and healthcare systems really used that time wisely and scaled up capacity at the laboratory level and at the clinical level to prepare for the inevitable imported cases that they're going to be seeing over the next few weeks to months to come.
All right, Dr. Isaac Bogoch in Toronto, thanks. And that is Global National for this Wednesday. I'm Dawna Friesen. It's Pink Shirt Day, and in honor of that, we leave you with this. A show of support for the anti-bullying campaign drew crowds and smiles in downtown Vancouver today. The theme of Pink Shirt Day this year is to lift each other up. Give it a try. And thanks for watching. Bye-bye.